main areas of the brain impacted by trauma. If you suffered from a traumatic event, then you know what the aftermath. In this session, I'm going to give an overview of the 5 main areas of the brain impacted by trauma. If you suffered from a traumatic event, then you know what the aftermath of trauma feels like, but you may not have an understanding of what is happening in the brain. My clients oftentimes find it helpful for an explanation of this, for me to explain what might be going on in their brain, because it normalizes that experience and it can really give clients hope for brain change that is possible after trauma. So we can think of the brain in 3 different levels or layers. We have an innermost layer that is called the survival brain. As we move up and out in the brain, we also get this center area, which is not so low, but it's about in the middle, about right here. And this is called the limbic brain. And the limbic brain is involved in emotional processing. These are the areas of the brain that are of particular interest to mental health professionals because they're involved in emotion processing, feeling into the body, memory, and some aspects of cognition. As we move to the top parts of the brain, we get this cortical area, and we think of these top areas as being very human areas of the brain. So, for instance, your dog will have a cortical area, but relative to other areas of the brain, it's going to be pretty small compared to how large your cortical area is. So beginning with that survival area of the brain, we're actually not going to talk about any of those areas because they're more involved in things like breathing, respiration, heart rate, things like that. But I do want to emphasize a few areas of the brain that are in this mid-limbic range and then in the top cortical areas. The 5 areas that I want to discuss are the amygdala. Don't worry, I'll say a lot about what these areas do. The insula, the hippocampus, the cingulate, and the prefrontal cortex. Beginning with the lowermost structure that is extremely important for us to understand trauma, we have this little area called the amygdala. And the amygdala is this tiny limbic area of the brain that's involved in threat detection and detecting danger. So Bessel van der Kolk has nicknamed this area of the brain the smoke alarm because its primary duty is to detect threat and danger. So if a tiger were to walk into your room right now, that's the area of the brain that would light up and it would greatly activate to try to prepare you to deal with this threat. So this is a fantastic area of the brain because it's really critical to our survival and we need it to activate in moments of extreme stress and life-threatening danger. So we by no means want to get rid of this area. However, sometimes in trauma or maybe anxiety disorders, this area of the brain can become hyperactive. So what happens is that this area of the brain begins to pick up on danger or smell smoke where there is none present. So we might begin to react to things that are actually safe and benign as though they are unsafe. So when the amygdala activates, what it does is it actually sends signals up to these top human, rational, logical thinking areas of the brain, and it begins to suppress their functioning. In other words, the more upset you get, the harder it becomes to think clearly. The other thing the amygdala does is it communicates with other low areas of the brain that are responsible for putting your body into the stress response. So when you go into that stress response, you might notice symptoms like a racing heart, shallow, fast breathing. You might feel tense. You might feel hot or shaky. And these are all stress symptoms. People who suffer from post-trauma symptoms will often report feeling that way all the time, always feeling rubbed up, on guard, tense, or maybe just the sense of free-floating anxiety or that something bad might happen. In addition, people with PTSD sometimes have difficulty concentrating because these top rational areas of the brain can become difficult to access. So you find yourself making more errors potentially, or not being able to focus as well on conversations with other people. After trauma, research has shown that the amygdala gets cranked up. You can kind of think of this area of the brain as a dimmer switch. So this is not a light switch that just flips on and off, but you can think of the amygdala as a dimmer switch that after trauma gets cranked up. And the effect is that it becomes harder to think clearly, it becomes harder to focus, and that chronic stress that's in the body is actually linked to several different medical conditions. So this is an incredibly small but very powerful area of the brain, and one goal of trauma treatment usually is to begin lowering the dimmer switch on this area. Another area of the brain that is extremely important in trauma is the hippocampus. And in fact, this area of the brain is so critical that it has its own video session. Actually, the next session, I'm going to discuss the hippocampus in detail. But let me give you a little bit of an overview of this area. Think of the hippocampus as your explicit memory center of the brain. And when I say explicit, what I mean is that it encodes the stuff that you can actually remember. So if you remember your last birthday, or you remember something that happened that made you feel very afraid, it's stored in the hippocampus. The problem after trauma is that oftentimes this area of the brain becomes unactivated or more lower activation of this brain. So it's kind of like the amygdala in the sense that it has a dimmer switch. During times of intense stress or trauma, this area of the brain oftentimes will not fully activate, which can lead to errors in memory encoding. In the hippocampus session, I'm going to go into detail about what's happening in this area of the brain, how it becomes underactive during and after trauma, and how that can lead to errors in memory encoding. But the result for a lot of clients that I see is that memories don't feel like memories. They don't feel like something that happened in the past. Rather, when they remember a memory, they actually relive it. And these memories do not seem to age with time. This makes memories feel scary and dangerous, which then leads to avoidance of things that remind the person of that traumatic event. Also in that limbic area of the brain, kind of this midsection right here, we have a very fascinating area of the brain called the insula. The insula is the area of the brain that allows you to feel into your body. So it allows you to connect with internal experiences. And this is really key because if you can't feel into the body, or if you're feeling into the body, but you're receiving inaccurate information about what's happening in the body, then it's actually very difficult to know emotionally what's happening, and it's difficult to regulate thoughts, emotions, and behaviors. So in 2 sessions, we're going to talk about trauma and the loss of self. And when I talk about the loss of self, I'm going to really talk about impairments in this area of the brain, the insula. The fourth area of the brain, critical after trauma, that's really impacted by trauma, is called the cingulate. And the cingulate is an interesting structure because it is a limbic structure, so it is a little bit hidden deep in the brain, but it's kind of a 2-in-1 in that it's also a cortical area of the brain, meaning this top human layer of the brain. There are parts of the cingulate that are within conscious awareness and conscious control, which is probably helpful because this is thought to be a self-regulation area of the brain, and we would hope that self-regulation is something that we would be able to control. This area of the brain helps us to filter out irrelevant information in our environment, and it also acts as a sort of judge where it gathers information from other areas of the brain, puts it all together, and then draws conclusions from it. So it might say, based on what I'm getting, here's how we're going to think, here's how we're going to feel, and here's what we're going to do about it. So it's involved in emotion regulation and thought regulation, and it helps us make good decisions in our lives. It's also responsible for something called conflict monitoring. And what that is it's when you think or feel 2 different things at the same time, and your brain has to work through it. So maybe, for instance, and this is kind of the stereotypical example, maybe you go to therapy and your therapist asks you how you feel about your mother. And you feel that internal conflict come up because you love your mother, but maybe you're irritated with your mother at the same time, and you have these mixed feelings. And you feel sort of that internal back and forth with yourself, that conflict. That's actually the cingulate activating. After trauma, we see on neuroscience scans, on brain scans, that this area of the brain is not as active overall. Many components are not as active as we would like it to be. And this can lead to difficulties with filtering out irrelevant information and sorting through our feelings, regulating emotions, and determining what actions to take. Last but not least, a very important area of the brain in trauma is called the prefrontal cortex. And the prefrontal cortex is a cortical area. It's very, very high up, and it's about right here, actually. Okay, so if you were to go through your skull, the piece of brain that you would hit right away right here is your prefrontal cortex, and it's at the front part of the frontal lobe. You have a left side of your prefrontal cortex and a right side, and we don't have to go into detail about that. But what I want you to know is that this prefrontal cortex is actually a pretty large area of the brain with several subcomponents that researchers get very, very excited about. And overall, this region of the brain is involved in something called executive functioning. So what that means is that it's involved in things like attention and concentration, problem solving. Your sense of self is in this area, and your connection to other people is in this area as well. So this is not a survival area of the brain. In fact, you could blow out a lot of these areas, destroy them, and you might still be alive, but you would not be you, and you would not function very well. While I don't think that we have to go in detail about all, 10 or 20 areas of the prefrontal cortex, I do want to distinguish for you between a couple of different areas. Specifically, the center or midline area of the prefrontal cortex, and then the outer areas. So what you can do is think about it like this, if you want to remember what these center areas do. At your center, it's all about you. So it's these center midline areas of the prefrontal cortex that are involved in your sense of you, your sense of self, your thoughts about yourself. It's also where a lot of your personality resides in the brain. And when this area becomes underactivated, as it often does after trauma, individuals might have a hard time with self and identity and knowing who they are. Sometimes people who have been traumatized early in life aren't even really sure of their likes and dislikes. So these center areas are really key to you knowing who you are. As we move to the outer sections of the prefrontal cortex, the technical name for this is dorsolateral, but basically it just means these outer sections. You can think of this as being focused on things outside of you. So at the center, it's all about you, and then on the outside, it's all about other people and other things. So in these outside areas, they're involved in things like tasks, keeping a narrative of something that's happened, focus and concentration and decision-making, and your connection to other people. So empathy is in these areas, and something that we call social intelligence, or EQ. And that might be, for instance, being able to look at someone's face and determine what they might be feeling based on their expression. In trauma, these areas also become more lowly activated, which means it can be hard to problem solve. It can be difficult to come up with creative solutions. We have this concept called cognitive rigidity, which means there's a lack of creativity. It becomes difficult to imagine a different future, and it can become difficult to connect with those around you. So you might be around other people and interacting with them, but my clients tell me sometimes they just feel like there's a wall between them and other people. And this can happen with trauma. So to summarize briefly, these 5 areas of the brain and what they're doing, we have the amygdala, which is hyperactive. Remember, it's that dimmer switch that is cranked up. which makes you feel on guard and vigilant, like you can't relax. We also have underactivation of that memory center of the brain, the hippocampus, which leads to encoding errors, leads to memory errors. We also have dysregulation of the insula, where when it's underactive, clients will report feeling numb or maybe even dissociative, where they don't even feel like they're in the present moment. They might sort of disappear, they say. Or the insula can be hyperactive, and when it's hyperactive, that might be when they're re-experiencing the feelings of the traumatic event if something triggers that memory. In the cingulate, that self-regulation center of the brain, we see underactivation, and this makes emotion and thought regulation very difficult, and it becomes difficult to factor out irrelevant information. And finally, we have the prefrontal cortex, these areas up here, which are largely underactive after trauma, resulting in difficulty with a sense of self, difficulty connecting with others, and difficulty with decision-making. So now, having an understanding of these 5 areas of the brain, I'm going to go into more detail in a couple of these areas because they relate very closely to EMDR skills and why we would choose to practice EMDR skills to heal the brain after trauma.